Hi, it's Jared from the Hardy Nutritional Science team. On the Daily Essential Nutrients label, there's a note that medication doses should be monitored by a physician while taking daily essential nutrients, and that psychoactive drugs may need to be gradually reduced or eliminated during nutrient therapy to avoid over-medication effects. Now, why would we make this kind of statement on the Daily Essential Nutrients label? Our experience over many years working with thousands of people who are using daily essential nutrients together with medications shows us that this is critical. I'll try to give two reasons why we make this statement. Hopefully they'll make sense. The first reason is that nutrients are used throughout the body to create all of the chemical components that help our bodies to function properly. This includes neurotransmitter and hormone levels that help our bodies to optimally function in terms of mental health. Let's take a situation where an individual already has optimal levels of neurotransmitters for their needs and hormones. I'll use the example of serotonin. If a person with optimal levels of serotonin took a selective serotonin reuptake inhibitor, commonly referred to as an SSRI, this addition would not make the person feel better. They would feel worse. They would experience side effects tending towards serotonin syndrome. It's an over-medication effect. They would have too much serotonin in their synapses. The brain would be overloaded with serotonin, and they would need to eliminate the SSRI. Their bodies already had what they needed. So now let's look at the situation of a person who is already taking an SSRI and who adds daily essential nutrients to the medication. Now, initially, the person taking the SSRI may have felt better if serotonin levels were suboptimal. The SSRI could have helped them feel better by optimizing the serotonin levels in the synapses or bringing the levels closer to optimal. Now, when we introduce daily essential nutrients, it contains the vitamins and minerals that are serving as cofactors to enzymes that are producing serotonin. And so the enzymes and the vitamins and minerals together are the machinery that are naturally producing what the body requires. So in this situation, the SSRI would quickly become too much for the body. Gradually, the person would need to reduce the dose of SSRI in order to maintain optimal levels of serotonin. Over time, in other words, the SSRI manipulation of serotonin would no longer be needed, as the body can naturally produce what it requires in terms of serotonin. So this is the first very important reason why we are making this statement on the label. There's another very important reason, and your medical doctor will understand this reason very well. And that is that the body uses CYP450 enzymes, mostly in the liver, but they're throughout the body, to process medications. When a person takes medication doses, the body processes the medication and eliminates the medication metabolites from the body. And so the person needs to take another dose the following day or later in order to restore active levels of the medication in the body. Those active levels are always increasing when the person takes a dose of medication and gradually reducing as the body processes the medication. So the challenge is that nutrient the nutrient levels that we're supplying in daily essential nutrients are interacting with the processing of those medications. They're affecting the rate at which those CYP450 enzymes are able to break down the medications. And this is very critical because that means when the rate of processing is slowed, the active level of medication, the level of active medication is increased day by day. And this would lead to medication overdose. So in this situation, the body needs relief by a reduction in the level of medication. Now there are other reasons as well. In some cases, as in stimulants, nutrients including calcium and magnesium may increase the absorption of the medication the person is taking. And that would increase the active levels of stimulant in the body. So for these two reasons, first, that the body is using vitamins and minerals to produce the neurotransmitters naturally and no longer needs the manipulation of medications over time. And the second reason being that the nutrients, including vitamin A, vitamin D, niacin, zinc, copper, vitamin B6, perhaps among others, nutrients are slowing the rate at which the medications are processed in the body. This is also a critical reason why medication levels should be gradually reduced with the help of a medical doctor over time. Now, in practice, this process looks like this. We recommend that individuals, at least weekly, assess the side effects of medications. And inevitably, or generally, what we see is that side effects increase as the nutrients are used together with psychiatric medications. So, if the side effects are increasing in intensity, or the number of side effects are increasing week by week, this is a sign to you and to your medical doctor that it's time to gradually reduce the dose of medication. And we see that people receive relief when the dose of medication is reduced. And this process is repeated. After the first reduction of medication, side effects tend to gradually increase again over time. And reducing medication level again brings relief. And this process of gradually reducing the medications as required, based on side effects, is what we recommend. Now, you're welcome to call us and we'll help talk through what you're experiencing in terms of side effects. It's critical to involve a medical doctor as well in this process. Now, it's important to note as well that the nutrients do not cause these side effects. We've seen in multiple double-blind studies using broad-spectrum vitamin, mineral supplements that they do not cause the kinds of side effects that we see from medications. There are no differences in side effects, in fact, compared to placebo, nutrients versus placebo. So these side effects are coming from medications, and the reasons I've discussed hopefully make sense as to why.